for those who have experienced loss before, or even those who haven't, coming to a scan sometimes can be pretty scary. It might be in the same room which previously you've had some bad news, or it's just thinking about what a scan brings and what they're looking for, really. So I guess do you have any advice for those who know they've got a scan coming up, or they're waiting for their scan, and how to really kind of cope with that anxiety around those scans?
Yeah, I mean, I think the first thing to say is that I completely understand. You know, I think it's absolutely normal to feel anxious. So very often women talk about the fact that this was the room, like you said, this was the room I was in last time.
Yeah.
This is the hospital I was in last time, and it didn't end well. And so that is absolutely valid. I think it's really important that women know that we expect that from them, and that's okay, and that it's completely valid, and that it's quite normal, and those anxiety levels are not going to do any harm. They don't, you know, they then immediately say sorry, or they don't want to feel like that, but it's completely understandable. And then in terms of managing it, it is very tricky. It's very difficult, but the nurses who are doing the scans are really, they're really understanding of the situation, and they just want to be able to help. So if you feel as though, I mean, I've had women who've come in and they don't want to look at the screen, or they've got their earphones in because they don't want to hear anything, or they wear their lucky t-shirt. You know, there's lots of different ways, and the nurses will do whatever they can to help you to get through that scan. And of course we know that it offers some reassurance at that point, and then you've got to try and get through the next day and the next day, and it is difficult, but it's completely understandable.
And it's just trying to take it each day as it comes,
every day, one at a time.
'Cause I think sometimes looking at a whole pregnancy can be quite overwhelming. So
how am I going to get to the 12-week scan? I'm only 4 weeks and I've done the pregnancy and everything, and it's too much. So you've got to just try and get through to each day, and then get to the next scan, and just to know, I often say to women, you're going to be okay. This pregnancy might be absolutely fine, or it might end in miscarriage, but you're going to be okay, and we won't give up, and you can still have your hope for next time, but that you will cope. You have coped before, and you will cope again, and that there is a lot of support. That Tommy's have got the phone line that they can phone, or we've got our emails that we can answer, but that you're going to be okay.
Brilliant, thank you.
Hello, I'm Oonagh. I'm one of the nurses in the Tommy's Recurrent Miscarriage service at Birmingham Women's Hospital. We understand that early pregnancy is a really difficult time for women who've had miscarriages before, and it's a really difficult time for women during this global pandemic. We understand that anxiety levels are rising. I need to tell you about some of the changes that have been made in the way we can look after you in early pregnancy. And these service provision changes have been brought into place to reduce the number of people leaving their homes and coming into hospital. These measures will protect you and your baby and the staff working in the hospital, and the Royal College of Obstetricians and Gynecologists have collaborated with Tommy's and the Association of Early Pregnancy Units to produce guidelines for the management of women in early pregnancy. These guidelines mean you will only be offered an appointment to come to hospital if the benefit of leaving your home outweighs the risk of coming into hospital. Lots and lots of the care and support that we would normally provide is now going to be via telephone or through the GP. And we'll always make sure, all of the nurses and doctors will always make sure that you're safe and that you're followed up appropriately. If you have any concerns in your early pregnancy, the best person to ask is your GP first and foremost. And they will then follow the guidelines and triage and refer to us if they feel as though you need to be seen in hospital. If you feel you need more support than that and further advice, please keep in touch with Tommy's. We're still here for you. Women in early pregnancy always surprise themselves at how strong they can be and how much they can cope with. But we do understand that sometimes you need someone to speak to. And so the Tommy's Pregnancy Hub is still open, and there are midwives and advisors there for you. We know we can't change the outcome for you, and we're really sorry that we can't provide our usual vital clinical service or research. But stay strong. We see strong women every day in our hospital, and we know that you will be okay. If a miscarriage does happen, we will be there for you to support you and keep you safe. So stay at home, stay safe, and stay strong.